before we get going, there's quite a lot of you on the call. You'll just hear the recording in progress announcement that tells us that there will be a recording of this webinar available afterwards on the CHASNZ website. So just a couple of bits of admin, really. Number one, feel free to use the chat function. I'll keep an eye on that. We've got the Q&A function open, which some of you have already used. So if you've got questions, particularly as we're having this discussion, just fire them straight in. What we will do is run this webinar more in a sort of podcast style, more of a discussion. So as Sue, I'm about to introduce, is talking about her subject matter, it's likely we'll interrupt her with your questions or my own questions, and we'll get more into a discussion style. So hopefully you'll find that more useful than just a presentation, and we'll try to get into some practical takeaways for everybody, because I'm sure that many of you have dialed into here because lots of people struggle with this topic of contractor management. I've been thinking of another word for it because I think the term contractor management is fairly misleading in itself. So I'm kind of proposed contractor care was one that I've just written down. I don't know, that's probably a bit woolly for some people, but probably a better description of what we're really talking about, which is, how do people who buy services of contractors, how do they look after them rather than how do they manage them? So, but we'll get to that. So, we'll just pull up some slides. One of my colleagues is sharing of that. So we'll wait for the magic to happen. Look at that, it works. And if we just flick to the second slide, we've got my colleague Susan in the background. So today myself, I'll be hosting and hopefully kind of holding this together and making sure that we don't overrun. And add in a few questions. And my guest today, which we're really chuffed about, because Sue's time is precious and difficult to get time with Sue sometimes because she's busy trying to help people with this subject over in Australia. So introducing Sue. Next slide, Susan. I first met Sue in person at the Global Safety Innovation Summit that was on in February earlier this year over in Wollongong in Australia. And we'd already connected because I have the privilege of being asked to co-author a chapter on contractor management for the Australian Institute of Health and Safety. And just by virtue of coincidence, as you'll see, and Sue's right up in front of you, that Sue actually was one of the inaugural professional certified chartered members of AIHS. So there's a real strong link there. So yeah, Sue and I are collaborating really to try and provide a chapter in the body of knowledge to try and provide more clarity on what this big, difficult subject of contractor management is. So keep an eye out for that. We're looking to, do you remember, Sue, when we meant to have that done by? Probably should know.
Sorry, what was that? Do I remember what?
When do we expect that chapter to be finished?
God. It's a year. We've got a year and we need to get our skates on.
Yeah, we do. Yeah, we do. Okay, so that's probably all the intros done. So we'll flick over to the next slide and I'll hand over to Sue and we'll get going with this, what I'm hoping is quite an interesting and lively debate and discussion. Because we know it's an emotive subject, so we'll probably have a few people triggered along the way, no doubt, including myself.
Yeah.
Sue, over to you and welcome.
Thank you. Look, it's great. I wish I was there actually in person. And I was just saying, I think I better organise a work trip to New Zealand because I've only been there once, but it's absolutely beautiful. No, twice, and it's absolutely beautiful. Look, welcome everybody. And yeah, thanks for the opportunity and very kind words. I've been basically staring myopically at the issue of contractor safety management now for nearly 15 years. It's all I think about. And it is my area of practice, both in law and in safety. And I just want to make the point that I've been a safety professional for about 25 years. I've been a safety lawyer for 15 of those years. So I'm still very skewed towards the practical management of safety on the ground. But it is critical and important that we understand how the law obviously frames what we should be doing. And I think just that comment about, what should we call this? The reality is it is contractor safety management. always put the word safety. This is not contractor management in a general sense. It's not commercial, it's not quality, it's not any of those things. It is about contractor safety management. And it is about the safety of contractors. There is a duty in the legislation. Obviously, PCBU, as a PCBU, you have a duty to ensure the safety of workers. Contractors are workers. And to be perfectly honest, that is where it all goes wrong, okay? Because everyone goes, great, I've got, well, not great, but I have this duty to contractors are workers. I need to be considering them in my safety arrangements. Oh, so that must mean they are the same as my own workers. Therefore, I'll manage them the same way. And that's where it just all goes wrong. Okay. We need to think about our contractor safety management in a completely different way to our own workers. The reason why they are included in the legislation in terms of there is a duty is not to create a relationship where they become your workers who are under your management and control per se in the entirety of what they do. They are workers that are entitled to be kept safe from you. And yet, almost every contractor safety management system stares absolutely almost 100% of the time on them. We need to turn the mirror on ourselves. That is the first point that I will make. The next point I'll make is they are PCBUs just like you. So they are PCBUs like the people who hire them, and they have exactly the same duties under the legislation. So what we do is it's not they're here or we're here and they're here and they are underneath us. We stand shoulder to shoulder with our contractors to create a safe workplace. So we go, here's our contractor, PCBU, 100% control of their stuff, us, a PCBU, principal contractor, PCBU, and where we need to be thinking about is this bit in the middle. Where do we impact one another? So how can we harm our contractors and how can they harm us? That's really what I'm interested in. Quite frankly, I'm not concerned in how a contractor is managing safety in respect of its own workers and their methods of work. What I'm interested in is how I can harm my contractors, and probably best to narrow it down to how I can kill them or put them in hospital. And the same is I'm concerned about how they could kill or put one of my people in hospital. That's the bit. So what we can do is immediately narrow our focus and get our efforts so much more effective and worthwhile. So I've got a little, we're going to start off with a little video that I made during COVID. And it's a little bit of a parody of what happens a lot in the pre-qualification space. I just want to make the comment that, so just what I've talked about, so we need to think about our contractors differently and focus our efforts on, that element in the middle, which is where, so when we talk about the 4 elements of contractor safety management, pre-qual, onboarding, assurance, and performance review, everything we do in those 4 elements needs to be seen through that lens. So today we're going to have a bit of a chat about pre-qualification. And what we need to do is think about pre-qualification through the lens of, I'm not controlling my contractor and how they do their work. They are a PCBU. They have primary duties. They manage and control all their own stuff. How do I pre-qualify a contractor to ensure that where we have some due diligence around where we do impact one another? So we're really going to unpack, what does pre-qualification look like? What is it supposed to do? What are we trying to make it do? And what the outcome might be. But we're just going to play a little video. I hope you find it funny. It's meant to be just a bit of a, and people laugh, and I think generally because they laugh because they can relate. So I'll just get you to play the video there, Susan or Carolyn. Oh, have we got sound? Technology, it's always the way.
It's weird because it worked in
It worked just before. That's okay. Do you want to have a play around with it? And I can keep talking. It's fine. I'll keep talking. Okay. So the other thing to think about is that the way when you think about contractors, the phrases in respect of the duty is we have a duty to contractors and there's duties of contractors. So we have a duty to them to ensure their safety, and they have a duty to ensure our safety is not impacted by their work. And I have to say, I think this is where most safety professionals really struggle to let go of that whole, but I'm responsible for absolutely everything that happens in my workplace. Yes, you have a general obligation to create a safe workplace, but there's a couple of things that really impact that. One is reasonable practicability, and the elements of reasonable practicability, which is and it's the three there's the 5 elements, and it's the 3 elements of knowledge, suitability, and costs that have really been looked at by the courts in relation to what that duty looks like. And at the end of the day, from the knowledge question, the contractor has the knowledge and expertise to control their risks. Is it appropriate to be taking control over a contractor's methods of work? And from a safety point of view, that actually creates a whole bunch of problems, because did you want to have another go at playing, or are you still mucking around?
Yeah, we'll have another play.
Okay, great. Okay, cool.
One moment. Sorry, everybody.
That's okay.
Technical, 1 moment.
That toilet's blocked up again.
Oh, I better get a plumber. I better send him our safety questionnaire so I know that he's being safe. And I better ask him for some documents as well.
Here's the safety questionnaire from our lady of perpetual anxiety.
Oh, I better get some help with this. Hi, I'm Peter the Perfect Plumber, and I've been asked to provide some safety documentation. I really don't know what to do. Can you help me? I need some help ASAP. Hello, Safest Houses Safety Consulting. Oh, yes, I can help you with your safety documentation. I can get something to you straight away. Or better yet, I can actually get it straight to your client if you wish. Okay, great, thanks. I'll get something out straight away.
Here's the safety paperwork from Peter the Perfect Plumber.
Oh, I don't know what to do with this. I don't know.
I love that, Sue. That's so good. Hey, while we move into this area, there was just a couple of questions that came in, Sue, which I thought were probably relevant to what you were talking about. So, in fact, we just had a comment from Lindsay saying that she loved the video, and me too. So, thanks, Lindsay. The first one was just a reminder, because there was that opening slide about the 4 pillars. Can you remind everybody what those 4 pillars are, Sue?
Yeah, so the 4 pillars are pre-qualification, onboarding, assurance, and performance review. And, you know, those concepts are pretty common in the contractor management space, but what is important is how we think about them. And because generally it's been thought of as in, okay, I'm looking at the contractor and how they manage everything. And that's how we tend to do it, even through those 4 headings. So they're the 4: pre-qual, onboarding, assurance. I used to use the term monitoring, but it's actually not monitoring. It's assurance, and it's performance review. And that's probably something that happens very, very rarely. And the first element, as I said, what we're talking about today is pre-qualification, which is due diligence. Pre-qualification is about due diligence. But the other question, I can see it there. Did you want to ask that one, John?
Yeah, so thanks for that, Sue. That's really good, because I quite like the way that you've hung contractor management off that framework of those 4 pillars. I think those frameworks are really useful just for us to have some area of focus and understand, you know, what we need to do. So I just find those things really useful. Reese just popped in. Reese Jewell, thanks, Reese. Reese said the video was genius, which I agree with. I really like that. So Gary popped in a question while you were talking just before the video, Sue, and he said that it was interested in your perspective on what he says is a clear expectation from WorkSafe currently, that's WorkSafe New Zealand, that main contractors are liable for how subcontractors, workers perform their health and safety duties. Do you want to comment on that?
That is the most perfect segue into the next slide. It's quite funny how these things happen, you know. So there was a New Zealand Supreme Court decision in 2018, and it basically looked at this issue around the obligations of a principal contractor to ensure that contractors, subcontractors are meeting their health and safety obligations. And the reality is, and this was the finding or what they held, it is clear that Section 18 cannot be intended to be a provision which in effect requires a principal to be an insurer in respect of compliance with statutory obligations by contractors. So that it's what they're saying there is that there is no blanket obligation on a principal contractor to be ensuring that contractors are meeting their health and safety obligations. It is more nuanced than that. So the issue must always be one of fact and degree as to whether the delegation of responsibility to address a particular issue relating to safety was appropriate. This question of delegation, people really get caught up on, but you can't delegate your health and safety obligations. You're not delegating them. What you're doing is bringing in another party who has more qualifications and better competence to manage safety for a particular issue. You know, I bring in a crane operator because I don't operate cranes. And it's completely bonkers to think that I should be out there telling them how to operate their crane. And, you know, one of my colleagues here in Australia, Harold Downs, has made the point that, quite frankly, it could well be illegal. I'm not licensed, and I'm not qualified, and I'm not competent to actually direct that specialist contractor. So there are times where what we're doing is using the contractor to meet our obligations to have a safe workplace. And then the second one, or whether the principal should have retained a degree of authority and responsibility in respect of the issue in question. And so the reality, and that's that management and control question, as to whether or not the principal contractor has management and control or directs or influences the way the contractor is actually doing their work. And, you know, this is about the things over, you know, I said where we touch one another. So, you know, I'm a manufacturing plant. I definitely have control over a whole bunch of risks at my site. And a classic example would be traffic management or safe movement around the site, okay, or in construction, safe movement around the site. I have a contractor attending that site who is going to be, and cranes are always an easy example, going to be bringing a crane on site. I know nothing about how to work a crane. I really know nothing about lift plans and chains and weights and all that stuff. What do I know about? I know about safe movement around the site, and I know about traffic management on my site. So what I want to be doing is interacting with that contractor and making sure that contractor has in place risk controls to control that risk. Okay, because that's what I have authority and responsibility for. So we really need to start getting good at analysing who has control over what. And the reality is, it's funny because, you know, we kind of go, oh, well, you know, I just need to, you know, take control or whatever. You know, the research repeatedly shows that what happens is confusion. So the contractor comes in, they've been operating cranes for years. They arguably know what they're doing. We'd like to think they know what they're doing. They're reputable. They've got their licenses. They go and do this stuff all the time. And then the clients start saying, oh, no, you know, we're going to get involved. So there's confusion over who's actually running the show. And that is a problem in terms of liability, you know, in the event of an incident. And then there are problems even directing the worker who's operating the crane. And we've had cases here where, you know, a client has actually directed the operator of a crane to do something that was very unsafe, and someone was killed. And the saddest thing about that case, and so the principal contractor was in the gun, as was the crane company. And you know who got the worst penalty? The worker. It was an absolute travesty. So, you know, there is clear precedent law in New Zealand to say that the duty is not as wide as your regulators, probably like our regulators, would like it to be. It just isn't. And if you think about it from a practicability point of view, as I said, reasonable practicability says the control of the activity, the knowledge around the safety of the contractor's activities rests with them. So, you know, it is much more nuanced. But
there's a question relevant to what you just said about reasonably practicable, and I think you mentioned there were like 5 elements, like knowledge, suitability, cost. What were the others?
So there's likelihood and severity. So the likelihood of an injury, the severity of the outcome, and then knowledge, suitability, and cost. And in the contractor space, it really is the 3 at the end that are important. And the High Court in Australia has commented on this, where they've said, you know, the knowledge of the work, the risks, and how to control them rests with the contractor. The suitability, and I find this one really interesting, where it's, you know, is it appropriate? So the contractor turns up on site, they've employed their people, they've bought their equipment, they've designed their work methods, they are fully autonomous. Is it appropriate for us to start saying, no, you're now going to fall under my control? Then they're independent of you. And then the last one was cost. And the High Court has repeatedly recognised the impost on business to say, hang on, you know, you have to now supervise, go out there and be directly supervising the work of contractors. And so, you know, it was a really good question, and it really does lead into this finding. But unfortunately, and we have it here in Australia as well, is some of the communications out of the regulators, you know, can seek to move the dial. And we need to have that conversation.
Yeah, and I think that, you know, we had a comment rather than a question made that, like in New Zealand, relating to an issue I wasn't aware of, but apparently MPI, which are our Ministry of Primary Industries here, so government ministry, apparently were prosecuted for not ensuring safe systems of work down to labour hire during a clean-up. Some cleanup work in Cargill. So again, without getting too deep into that, what I would say is that clearly there's some disconnect there between what maybe the law says and what the regulator says, or whether there's a misunderstanding of what the law says. What do you think, Sue?
The comment I'll make there, and we're excited getting off topic here, but the reality is I always then, and the other thing I've looked at, and we may even have another session, is you look at when people engage contractors, they tend to look at them as, well, how am I going to manage them through a risk model? How dangerous are they going to be? What you need to do is look at them through a control model. Labour hire, which that case related to, is 100% under your control, because they're part of your workforce. So generally, and I want to, actually, it's a good clarification. So generally what we're talking about here today is independent skilled contractors, not talking about labour hire and not talking about, you know, the principal contractor appointment provisions. We're really talking about independent skilled. So let's make that really clear. Where it's labour hire, absolutely, you need to include them in your own safety arrangements, because they're a body brought in to work in your workplace, doing the work you do under your direction. So there is a real differentiation there. I noticed in the questions here, I'll just make a comment that people are asking about assurance, really struggling with assurance. Can I suggest that we may even have another session, because it's a really good topic. But
I mean, my flip side is that, you know, assurance. I mean, for me, there are 2 words: assurance and insurance, and they're quite different. You know, assurance is a bit like reassurance, right? Which is make me feel slightly better than I currently do. Give me a little bit more certainty because I'm feeling quite uncertain.
Yeah.
Whereas insurance is absolutely guaranteeing that what you need is happening. So that's the verification part. And actually, that's quite relevant. I might be wrong or right, but that's my own thinking, Sue. But that's come up a bit in the Q&A as well, which is people have said, although we were talking broadly about the first pillar, this issue of verification, and people have mentioned that it can be a bit of a balancing act, that on-site verification piece, like how far do people need to go? And it's likely probably it depends answer. So Sue, what's your thoughts around the site assurance part?
Yeah, so I'll get you to jump to the next slide because it's kind of if we can just move on to the next. So I think if we think about it through the pre-qualification, perhaps, verification is what happens after you've sort of started the work and they're on site and they're doing stuff, and we want to go, and that's a whole other topic. But again, look at it through the lens of what am I verifying here? Am I verifying, how the contractor's managing their own workers, or really, first and foremost, we need to verify we are not putting our contractors at risk. So again, turn the mirror. But if we look at what are we trying to do with pre-qualification? Are we trying to verify that a contractor is going to be operationally safe on our site through our pre-qualification processes? And I would point you back to the video. So Mary's there. She goes, I need to get a plumber in. Okay, I'll get all this stuff. And I don't know what it means. And yet that's what we constantly do. We constantly use documentation as evidence of operational safety. And I'm going to say I want to swear, but I'm not going to swear.
If you want to.
It's bullshit. It's bullshit. Because, whenever I give my presentations, I say to people, hey, listen, how many people agree or that the paperwork you got at the beginning of the project or as part of your pre-qual matches up with what actually happens on site? And pretty much everyone says, yeah, never. And the reason for that is because, and it's even, and what I find interesting is that is a problem with our own workers, and people be familiar maybe with the term blue line, black line through the, human organizational performance. So the black line is what the procedure says you do. The blue line is what actually happens, and we kind of touch the black line every now and then, but we're generally operating either side of that black line because we have to adjust. We have to make changes around how we work to be safe. But it is this, we really are using pre-qualification for something that it is not really effective at giving us. So what do we actually mean by it? And I do think we think that it's going to be an operational assessment of safety, and I really, really challenge that. So if you want to jump to the next slide, so why do we do it? What should it be for? Recognize its limitations. Don't try and, to my mind, if you actually want to look at the work methods of your contractors, which you should look at in relation to the risks they are importing to your site and how they're controlling them so that they don't harm your workers, that's an onboarding thing, because it needs to happen when the contractor either, know they've got the scope of work, they've even attended site, they've got more than enough information about what is happening in the work and the site and the risks involved on the site to actually prepare risk control plans that are relevant. And unfortunately, pre-qualifications, can be used, as I said, the questionnaire is sent out, could be months or years before somebody's actually given work. And we try and go, yep, that's exactly what they're going to be doing when they come on site. And worst of all, we then take what they gave us way back in the pre-qual, roll out on site and go, let's see if you're complying with what you said you'd do. And guess what? It's different. And then we get these problems around, hang on a minute, you're not complying with what you said, and all this kind of stuff. It is very, very problematic what we try and get pre-qualification to do. So my view is let's stop trying to make it do that, and let's limit it what it's there for, and it really is about establishing a legal relationship. And there was a comment in the comment section just before about, clarifying, the duties of the parties. And to be perfectly honest, I think that's what it's for. I actually think it is your opportunity to be clear on who you are and who your contractor is. And what you are is both PCBUs, both with primary duties, and who have an obligation to each other. And, making sure that your contractor is aware of that and signs up to that. and then aligning all your behaviour with that relationship. I so often look at pre-qualification processes that'll include, you know, various and say contractual clauses and so forth. And the first thing they say is the contractor will comply with all instructions of the principal contractor. The contractor will work under the direction of, the contractor will follow the procedures of. No. The contractor is responsible for managing risks arising from their own work without the direction of the principal contractor, except where the principal contractor has management and control or influences and directs the work. So we need to, so I think let's get it back to a much smaller role. Establish a relationship, confirm the obligations of parties, clarify operational responsibilities. Okay, we are going to manage site emergency response, but you're going to manage specific emergency response. I had a matter here in Australia where, again, a crane, tower crane, coming on site. The regulator said, oh, yeah, the principal contractor managing the construction site needed to develop and implement an emergency response plan to get someone out of a 30-story tower crane if they were immobilised. I just went, what? Have you seen what it's involved in getting someone out of a 30-story tower crane? It is a massively specialised and dangerous thing to do. The only people who are qualified or competent to do that is the crane company. And, you know, we had some discussions around that. Unfortunately, we came to an agreement that, yes, it is the obligation of the crane company to prepare and implement those arrangements. To then, the principal contractor needed to incorporate it into their arrangements, into the site safety plan. So they were there, they were known. Anything the site needed to do to support that needed to be implemented by the principal contractor, but there was a clear delineation. I've just noticed, so, you know, set expectations around what it is that you're going to be doing assurance on, and confirming, you know, good performance. And then that goes into the assurance piece as well. So it's really not a meaningful process to assess operational safety, I don't think. Okay. So let's stop trying to make it be more than it is. So maybe if we have a look to the next slide.
So Sue, just as we shift through, I thought I might deal with some of the relevant questions as some interesting early ones. And I suppose my own thought there in summary is that it sounds to me like what we're trying to do is that, you know, pre-qualification is good pre-qualification is an important step, but it's like we're trying to squeeze too much of the safety juice out of it.
Yeah.
Would that be a fair summary of what you were saying there?
Yeah.
And I think that's quite common with some of the comments as well from some of our listeners to this or watchers to this webinar. That there are some interesting points that really come up. So, for example, Chuck here has talked about, you know, has there been any standard advice for a meeting agenda section that would suitably prompt, you know, that PCBU to PCBU cooperation, communication, etc. That section 34 stuff. That would ensure that those obligations are explored versus a prime to contractor check.
Yeah, look, at the end of the day, really, we need to say, how are we impacting on each other? You know, this is our site. This is the risks present at our site. You need to know about them so you can design your work so that it's safe. I used to work for Shell. What was the one thing I needed to make sure the contracts really had their head across? Intrinsically safe work that couldn't explode the whole of Melbourne. You know, that was the reality. I didn't need to be really getting into, okay, how are you? I mean, I see people directing their contractors in manual handling and all sorts of weird stuff. You know, I really needed to be able to say my contractors really understand what this site is about, what the risks are that could hurt them or their work can impact on, and to enable them to design that work safely. And I have to say, there's some regulations over here in the mines, which, whilst the implementation of it has been less than ideal, the principles that sit behind it are perfect, because it basically says You share the replicable elements of your mine safety management system with your contractor. You get back their health and safety management plan. You check that their plan, aligns with that, your arrangements around your risks. And you confirm that you're satisfied the contractor is competent and has the resources to do the work. And they assure that they say, yep, and we're confident that, we understand and we're able to work safely on that mine. That's it. That is actually the most perfect model. And we really need to be doing that. It's interesting. Daniel Nash has just put in a question. So how do you pre-qualify? Go and watch your prospective MC work on site. No, you don't, because what you're actually doing is you go, that's an assurance activity. So we move that down to once the relationship is underway. But this is, and it's a good segue again into, what you should put in your pre-qual. So really have your clear agreements. So, okay, if you're appointing principal contractors or handing over control of the site, doing all that kind of stuff, then we need to make sure that is really, really, really clear. So, basically they, making sure they understand you have control of the site. It's our expectation that you'll be doing everything in relation to making sure that site is safe and meeting the obligations of a principal contractor. So you're stepping out of the picture. But the main thing, and then with independent contractors is make sure you confirm that you are the principal contractor. You are not managing their work. They are managing their work. They are a PCBU. Separation of obligation and activity, and confirm your reliance on them as an independent contractor expert or an independent expert to manage the risks. Now, it's interesting, anonymous attendee has said, how can you ensure that you understand the risks that contractors bring to your organisation without checking their documentation? If you're not on site to monitor when they're working safely. The thing is, and I'm not saying that all documentation should be thrown out the window, just probably 90%. So let's get really focused on, I want to know what are the critical risks that your work will pose to my work site and how you're controlling them to make sure my people and my operations are safe. And I will tell you about my critical risks that can pose to you. So what I'm saying is, let's just be much more judicious rather than saying, and I see it all the time, I want a copy of your health and safety policy. I want a copy of your consultation arrangements. I want a copy of your chemical safety plan. I want a copy of copy. Why? Just focus your attention. Okay, so we'll keep moving on. So the next one. So really, what should we be asking? So what to ask and why? And this is probably the thing where people get really nervous. Whereas I say, ask the question, get the answer and move on. A yes/no question. Are your people competent and or qualified, licensed to undertake the work they are being engaged? The question of licensing, we're obsessed with collecting licenses. At the end of the day, in the majority of circumstances, it's the obligation of the PCBU doing the work.
That's really relevant, Sue, because somebody in the question said, do they need to be checking the tickets of the crane operators? Yeah, thanks for covering that.
Yeah, and I just, the reality is it is the obligation of the person doing the work. I mean, there's about, I don't know, I think there's about 5 or 6 different crane licenses. I don't know,
Yeah, I don't know.
I don't know. I wouldn't know what I was looking at. And I do kind of use the example. I don't walk to the police station every day and say, here's my license, I'm about to drive my car, walk home, get in my car and drive. I get in my car and there is an assumption that I'm licensed until such time as it's checked and I fail that check. Okay. It's my obligation to be licensed. Now, you might make decisions and say, okay, for really high risk stuff, we're going to ask for, but again, ask for it when the work is being done. Preferably because, you collect the license, the next day it's out of date or they lose it or the different person turns up to site, all of those things. Those things really rest with the contractor. Confirm your core safety obligations under safety legislation. Not everything, but do you supervise your people? Do you identify, eliminate and reduce risk? Do you have emergency arrangements in place? And just get a yes or a no. But people say, oh, but I have to see a piece of paper. You know, what if they lie to me? And I say to people, well, quite frankly, they're probably lying to you with the piece of paper. So just make it more efficient. And I shouldn't say that, because contractors, to be perfectly honest, and it should say 45,001, not there's an extra zero there.
That's okay, Sue.
So I think, is it right? I always look at these zeros and get confused. But, you know, contractors have a commitment to and have duties under the legislation. And I think we always assume that they are the ones that are dangerous. You know, they're bringing all these dangers into my workplace and I need to be all over them. I just think we need to test that, particularly when we're using tier 1, tier 2 contractors. They probably manage safety better than us. And yet we put them through these hoops as if, oh no, you're all the problem and we're not. I'm not quite sure, how that's come about. The other thing is confirm the management of critical safety risks. Again, narrow your focus. The other thing is focus on outcome, not process. I often see, and training's a good example. So we say to people, do you use an RTO? Do you have a training register? Do you refresh your training? You know, or do you got a training matrix? Yep, I do all of those things. What doesn't that tell me? What assurance have I not given you? I haven't said anything or said, yeah, my people are competent. You know, the legislation is performance-based. We should be asking our questions in the same way. So I'm not interested in how you get there. I just want assurance that you're there. Because training could be on the job. You've got a small contractor. They've got three guys, 3 girls on the job training. It's a valid form of training. Or a larger organization, they may have their own training institute. It can vary, and it should vary based on the circumstances. So think about how you ask your questions as to what answers you're getting. And are you asking about, great, I've got all the processes, but whether or not I'm actually achieving the degree of performance that you want, I haven't actually.
And do you think, Sue, there's a level of confusion between what needs to be done as part of pre-qualification or due diligence work and what needs to be done around onboarding somebody that you're procuring the service?
Yeah.
Do you think that's one of them?
Yeah. I think that is one of the problems, is we actually put into pre-qual what probably should be in onboarding. So when we actually, and look, I do know that tenders and that can be a little bit different, because tenders, you know, they issue the scope of work and then they say, give us your plan around how you're going to respond to these risks and whatever. So the contractor actually has, you know, information and can design their work methods in the context of that. But a lot of pre-qualification is done before the work is even thought of, let alone actually, you know, any information issued to the contractor. So absolutely, we should be reserving a whole lot of staff for, okay, we've got you on our books. Now we're going to give you some work, and we're going to, you know, have questions around, you know, we're going to not have questions. We're going to consult with you about how things are being managed and how we manage them. You know, keep pre-qualification really efficient. The other thing is what you're doing is putting your contractor on notice about what they need to have in place, which then informs your assurance. So they've said, yes, you know, we have an emergency management plan for our high risk work, or, you know, whatever it might be. And you go, okay, great. Where is it? Down the track. But, you know, we need to just say, hey, listen, we want to establish the relationship, get our agreement. It's a bit like going on a date. So when you first go on a date, you know, we put on our best face and we present ourselves and we say, you know, we do all these things, and it's during the relationship that you actually work out whether that stuff is in place or not. So let's just make this process a whole lot more efficient, I think. And then, you know, obviously verifications of truth, putting my hat on as a lawyer to say, yes, I verify the information I've given is true, and, you know, I'll be held responsible in the event that it's not, and, you know, the agreement to the conditions. So just, rethinking about how we ask these questions and how much documentation we're asking for, particularly because that can just have such a massive negative impact on small and medium contractors, because you know, they do things like in the video, they go off and ask the consultant and have to spend $5,000 getting a, you know, a safety management system that's not being implemented for them. It's being handed over to their clients. And did you notice in the video, the consultant says, I can get something to you, or better yet, I'll send it straight to your client. So, you know, very much about why are we getting them to prepare this stuff? And is it actually evidence of what's happening on the ground? And that is highly questionable. The whole safety clutter issue. Okay.
So that's actually really relevant, Sue, to one of the questions that's been asked by Melanie, is that that she's really sharing her own experiences, that they realized that they were asking a lot of the same questions that were covered off in standards like ISO 45001 and similar. So they've since started just asking for those types of certifications, and if they've got them, that's cool. And then they're and then what they're doing then is asking more specific questions in their onboarding process. How does that kind of match what you're describing to the audience, Sue? Is that roughly kind of one of those?
Yeah. So look, I basically say, look, if you've got an external certification, and we know there are problems with external certification as to whether even they're valid, and the problems that go with auditing and all that kind of stuff. But at the end of the day, the company has signed up for, paid for, and gone through an audit process. Well, we accept that. We go, thanks, move forward. Great. Pre-qual over. And then move into conversations about the work. Whereas if they don't have it, that's when we then ask, you know, more questions about those key obligations and so forth. But yeah, for better or worse, at the moment, we do have, you know, accredited certification programs, which, you know, we are really bound to recognise. Otherwise, why are they there?
So what do you say to those clients, Sue? And we have some in New Zealand, because I've received some messages directly from some of these contractors where, like, you know, generally kind of, you know, contractors working directly for clients, where they have provided evidence of an ISO certification to prove they've got a safety management system which is broadly appropriate, which I think is about the best we can squeeze out of a pre-supply selection process. And then they're being asked to do commercial pre-qualification assessments on top of that. What would you say about that?
Yeah. Look, I think, you know, it depends. Like commercial pre-qualification can include things like collecting insurances, blah, that's all fine. I think the thing is to go, well, if they've been asked for if they're providing certification, that should cover all of those questions around their performance in relation to the compliance with the legislation and their safety management systems. Any questions in addition should really be targeted at the specific issues for the client's workplace. So, you know, and again, it should be about the work. So it arguably fits more into the onboarding space. But yeah, I do think it's a bit rich that we sort of go, oh, well, you know, yes, you've got certification, but I'm still going to make you jump through all these hoops. Well, you go, hang on a minute, it's very expensive and very time consuming to be certified. And the reason why people are certified is often because they want it as evidence for their clients that they are compliant and they have systems in place. So I think it is pretty unfair to, you know, not accept their certification. If we have problems with certification as a process or as a concept across industry, well, we need to deal with that. But yeah, I just think, well, they've got it, they've paid money for it, and ostensibly it's valid. Yeah,
I think that sounds like a sensible response. So there's an elephant in the room here, because there's a few questions coming in that are relating to you know, current pre-qualification assessments. And so we'll get into that, because I'm sure a lot of the callers would like to hear your views on this. But so fundamentally, we've got people saying that they've got, you know, a client that they're working with who's having to do 4 different commercial pre-qualifications. We've got people saying, well, having heard what you've said, you know, are these assessments useful at all? You know, what should people do? What should they change? What's your sort of general view on that? Because I think we've got a sense that people are feeling this, right? Is that we've got contractors who feel like they're paying a lot to have their management systems assessed independently. They're sometimes asked to double up, as you said. They're investing in management system certification and having to pay for pre-qual assessments, and there appears to be a lot of overlap and layering for that.
Yeah.
So how, I mean, what do you think? Like, how do we clean this up? Like, how do we move forwards?
Look, we do have to sort of say, hey, hang on. And I had a client even yesterday, I was looking at their season, and they had 4 different pre-qualification processes. And I'm like, really? Why have you got this? You know, let's have one. I mean, you might have different elements. So within the one pre-qual, you could have, you know, your commercial stuff. Give us all your business details, your insurances. By the way, insurance is not a safety management tool. It's a after the fact, let's get some damages here. So let's, you know, that's not a safety thing, but, you know, insurances and, you know, all that sort of stuff. Then we have our safety stuff, which is about, you know, either are you certified or can you please provide assurance around these key things? As I said, it would be identification, elimination of risk, supervision, competency, emergency arrangements, key things. And then within the same one, then go, okay, we need, our business has environmental things. So have a set questions around that. We may have, you know, I have schools that have things around working directly with children, you know, and so the way I design my pre-qualification is so that it can expand and contract based on what kind of business, you know, my client is running and what they need from their contractor to meet their obligations, to demonstrate due diligence. I did a webinar yesterday on working with children checks. And one of the problems with contractors is often, you know, contractors are being asked, you know, everyone's got to have a working with children check, even if you look at a school. And you go, well, that's not the intention of the legislation. Intention is to capture people who work directly with children. You know, contractors really do cop it in terms of, you know, we just want to go overboard. And largely driven by a real anxiety on the part of principal contractors about potential liability. You know, that's really what drives a lot of this behaviour. And that's why
let's just talk quickly about costs, Sue, right? Because that's really relevant here, is that as you know, we've discussed it before, the New Zealand supply chain is very small business heavy. So in construction in New Zealand, we're talking nearly 97% of all suppliers of services in our industry have got less than 20 people working in them. And they do all the frontline work broadly. So they're the ones that we kill and seriously injure. These are small businesses. They don't have a lot of financial resources and time. They're very busy delivering work for others. How do we provide a proportional response where a hiring client can get enough information to have that due diligence of those smaller suppliers without overloading them with paperwork and cost? Because the costing comes up so much. Like this, you know, people, you know, times are hard right now. And so people are really kind of having to make really tough decisions about what they invest in and what costs they can cut. So yeah, what's your views on costs around all this?
Oh, look, it can be massive. You know, we here in Australia have, you know, a plethora of online contractor safety management systems that charge contractors. Now, I'll be open here. I actually work with a company that does online contractor safety management for their clients, so clients can, you know, put their, and I have resisted over and over and over again this thing about the contractors should pay. I'm like, I just think that is an anathema to health and safety. And I think it's morally and, quite frankly, I think even potentially legally a little bit questionable. You know, and I think that is a practice that should just stop. I think contractors should not have to pay to pre-qualify for their contract for their clients. The client is covering their due diligence, so why put it on the contractor? So that's my kind of view on that. But also, yeah, be really judicious about what you're asking and what you're collecting. So don't force your contractor to go to Safest Houses Safety Consulting and pay $5,000 for a templated, off-the-shelf system that will never see the light of day. Okay, just really focus on what it is you actually need to see. And to be perfectly honest, in the pre-qualifications that I generally do with clients, I tell them, I wouldn't be asking for just about anything. Even things like, JSAs and all the rest of it. These are documents and processes that should be done with workers. Safety is about real work. It's about, I'm here, I'm doing the work. Yes, we can prepare generic staff to make that sort of thing efficient, but we've gotten to the point in safety where we're so wedded to generic paperwork that we've lost sight of why we're even doing this. And we're doing this so that workers can be protected.
Sorry, Sue, we've got 5 minutes.
Yeah. Okay.
Yeah.
So I think, to your point, John, stop charging your contractors to pre-qualify, and stop asking for just paperwork for the sake of it. Be very, very clear on what it is why you are asking for this stuff and what you're going to do with it. And you're not going to do anything with it. Stop asking for it.
I think that's really sensible. So yeah, we're definitely into our last 4. So I suppose it's probably for us just to kind of, just summarize what's being said here. So the purpose of this discussion really was that broad issue of contractor management. And I think, Sue, if you're up for it, we'll get you back to talk about some of those other pillars that I think there's a real interest in this. And certainly there was an interest in talking about the assurance side of it. People were really interested in that. Just a quick comment to our people who are connected online, that we've had something like 58 questions submitted. We've answered 24 of them, but we're not going to get to them all here. What we always try to do with our webinars, though, is go back through those questions and post some Q&A on the webpage. So where we host the webinar recording, if our speaker allows us to use the slides, we'll make the slides available in a PDF to download, and we'll provide some Q&A responses afterwards as well. So look, in summary then, what we're saying really is that we've looked at, if you like, pre-qualification, this first pillar, Sue, and what we've said is that, I suppose what we're saying here is that there is a confusion or misunderstanding about what needs to be in the due diligence section versus what needs to be onboarding, i.e. we've selected a contractor, now we need to do some stuff that's about specific for work. And I think that there's this conversation about how do we get really clear about what's important for people in individual businesses to decide in their context what they need to do for due diligence, depending on the context of the work and the context of the contractors. Is that a fair summary, Sue, or would you add anything to that? Have I missed anything important?
Yeah. Look, and I do think it's that sort of saying, look, why are we doing it? What fits within the pre-qualification? When are we doing it? Is it relevant, to be trying to get these details about specific work, or is that something down the track? And this summary here, I think, is really, okay, this is what we want out of a pre-qual, is we want to know past performance and experience in health and safety and the type and complexity of work. That's reputational. That's going to be references. That's going to be their name within industry. No pre-qual is going to tell you about that. Obviously, if they're accredited, we've unpacked that a little bit. I've put the policies and procedures in red because I have a problem with that. But, do they get qualified advice? Do you use a suitably qualified safety professional to give you advice? How do you select do they have a due diligence thing with their subbies? Performance standards, do they have them? What do they do about accident reporting, issue resolution, performance monitoring, and review methods? So these are the sort of things that we want to know about, rather than, can I see your procedure for, or can I see your policy? It's these kind of considerations that are the things that should be woven into our pre-qualification process, and not just questionnaire. It's a process pre-qual. The questions are one part. But yeah, it's really thinking differently about what is pre-qualification trying to do, what are we trying to make it do, and how can we keep it efficient and stop, I suppose, encouraging this continuation of really smoke and mirrors.
So thanks, Sue. I think we've hit the end. And
I know, we have.
Conversation and discussion will continue. As we've always said, being really honest, the way that pre-qualification is done now isn't going to go away anytime soon. So I think that certainly the efforts that we're making with Tortica to actually declutter it and reduce that repetition and duplication of effort is a good step in the right direction. But what I'm hearing is that we could probably, as a community, do more. I just want to thank everyone for dialing in. That's been a brilliant community of people that have dialed in. I'm sure there's stuff you agreed with, stuff that you didn't, and that's all cool. This is quite uncertain, and we're working some of it out. Although at least we've had some clarity from Sue really about what the law might be telling us, which I think is always useful. So hey, look, thanks, Sue. We will twist your arm to come back, and we're definitely going to get you into New Zealand. So we might even be able to do something in person at some point in the future, which would be really cool to see you here. And Susan and the team is going to tell us what our next one is coming up next month. Susan, before we go.
Is she there?
Hello, everybody. Gosh, it's almost
Yeah,
like
so what's the next one, Susan? What we're doing next month?
we have a few on the agenda at the moment, which I would like to keep a little bit secret because it's actually a really good one. But there will be sort of some information being sent out. So this webinar here will be uploaded onto the website in the next sort of couple of days with the presentation. So look out for that, and then look out for a exciting EDM to come out in the next sort of week or two for our next webinar.
Can I just, sorry, can I just, Gary Clarkson just put up, Sue, I hear WorkSafe NZ are looking for a new CEO. Fancy a change.
Yeah, go on, Sue. We'd be up for that. I'm not applying.
Thank you. It's great. And look, a lot of what I say is really controversial. So love, lots of people, oh, what do you mean? So it started.
And I know we're overrunning, but a really good plug to a friend of mine, and I know a friend of Sue's, Joe Prickmore, who just put a comment about that, they worked with Sue a wee while ago, and they're certainly at Fulton Hogan moving more towards verifying what's going on in the operation rather than worrying about what's going on in the office. And so I really applaud that. Although she corrected me that that's assurance and not insurance. But I think what I said was insurance, but it's probably my Yorkshire accent. I think insurance and assurance are quite a good thing to differentiate. I think the standard's different. Yeah. So hey, look, that was really cool. We'll get you back. Thanks for listening in. And as Susan said, we'll get this stuff on the website as soon as possible for you all, and we'll try and get to answering some of these questions. I'm really sorry if we appear to be ignoring some of you. It's there was a lot of you here today, and we really appreciate the support. Okay, I think we're done. Let's go and do something else productive. Thanks, Sue.
Thank you, guys. Bye.